Driven by both policy support and technological breakthroughs, AI healthcare is entering the deep waters of commercialization. Centered on a hybrid white box plus black box architecture, synergistic empowerment through computing power, algorithms, and data is emerging. Primary care diagnostics and AI-driven pharmaceutical development are becoming key breakthrough areas. With a trillion-won market already initiating a transformation that is reshaping the healthcare ecosystem. Shortly after New Year's Day 2026, an AI-powered imaging quality control system operated smoothly in the radiology department of Beijing's Genjiuku Community Health Service Center in Haidian District. Morning sunlight filtered through the blinds onto the workstation, where a blue cursor danced across the screen. During the absence of on-duty radiologists, this AI system handled the full-volume screening task, analyzing every Lang CT image to precisely mark suspected nodular areas, assign risk ratings from low to high, and even annotate critical details like nodule size, shape, and density. This detailed preliminary screening report is synchronized in real time via the Medical Consortium Information System tool. Radiologists at higher-level hospitals. Physicians need only focus on high-risk cases for review, eliminating the need to manually examine every image frame by frame. NIS AI Initial Screening Plus Expert Review model is quietly transforming the diagnostic workflow at primary healthcare facilities. Meanwhile, at Yingxi Intelligence's Shanghai headquarters miles away, a major announcement scrolls across the electronic display in the first-floor lobby. The company has entered into a multi-year R&D collaboration with Sanofi, France's second-largest pharmaceutical firm, to develop novel drugs targeting challenging anti-cancer targets. The partnership is valued at $888 million. Within half an hour of the announcement, Insilico's Hong Kong-listed shares surged by 3.2%, signaling capital markets' endorsement of the deal through tangible action. These two seemingly unrelated things, one rooted in grassroots medical practice, the other driving global capital together, paint the true portrait of today's AI healthcare industry. As policy incentives continue to unfold and technological breakthroughs emerge, this transformation reshaping healthcare resources has quietly entered the eve of its explosive growth. From equipment upgrades in primary care clinics to R&D collaborations with multinational pharmaceutical companies, AI technology is permeating every capillary of the healthcare industry in a comprehensive and profound manner. Underpinning this transformation is a set of data poised to reshape the industry landscape. According to the 2025-2026 China AI Healthcare Industry Development Report released by Tulao Research Institute, China's AI healthcare market size reached 115.7 billion yuan in 2025, marking a 40.1% year-on-year increase from 82.6 billion yuan in 2024. Projections indicate this scale will surpass 160 billion yuan in 2026, maintaining a high growth rate exceeding 40%. Within specialized segments, AI medical imaging and AI pharmaceuticals serve as dual engines of growth. The AI medical imaging market reached 28.9 billion yuan in 2025 and is projected to surge to 59.2 billion yuan in 2026, representing a 104.9% year-on-year increase. The AI pharmaceuticals market will reach 15.6 billion yuan in 2025 and is projected to surpass 32 billion yuan in 2026, representing a 105.1% year-on-year increase. Both sectors are poised to double their output value. Does this growth trajectory not sufficiently demonstrate the industry's immense potential? What's more noteworthy is that this growth stems not from short-term capital speculation, but from genuine clinical demand-driven spending. Equipment procurement by primary healthcare institutions, R&D collaborations with pharmaceutical companies, and regulatory service purchases by medical insurance departments have all become core drivers of industry expansion. Few have noticed that the seeds of this transformation were sown years ago. Continuous policy guidance and standardization have laid a solid foundation for industry development. In October 2025, relevant authorities voted to amend the cybersecurity law, specifically adding a chapter on AI security and development to explicitly incorporate AI advancement into the legal regulatory framework. The decision proposed supporting fundamental AI research, computing infrastructure development, and breakthroughs in core technologies, while also requiring strengthening AI risk monitoring, assessment, and security controls, and establishing robust systems for algorithm registration and accountability. This clearly delineated the industry boundaries between encouraging innovation and mitigating risks. This legislative move ended the previous state of unchecked growth in AI healthcare, providing clear compliance guidance for corporate R&D and hospital applications. Prior to this, in 2023, the National Health Commission issued the guidelines for the clinical application of AI-assisted diagnostic products trial implementation. In 2024, the Ministry of Industry in Information Technology, in collaboration with multiple departments, released the action plan for the innovative development of medical AI. This series of policies formed a comprehensive system of top-level design plus concrete implementation, paving the way for the orderly development of AI in healthcare. By 2026, policy efforts have become more targeted, with deeper implementation at the local level. In January, Beijing simultaneously released two new policies: the Action Plan for Supporting AI Application Development in Healthcare 2026-2027 and several measures to support AI industry innovation in healthcare. These policies establish a robust framework for AI healthcare implementation across multiple dimensions, including clinical demand alignment, data governance, support system development, and industry cultivation. The action plan outlines three core objectives. By 2027, achieve widespread application of AI technology across the entire medical process, with AI products implemented across all healthcare institutions in the city. Cultivate over 10 leading AI healthcare enterprises with core competitiveness, forming 3 to 5 distinctive industrial clusters. Uncover a batch of key core technologies, propelling 5 to 8 AI healthcare products into international markets. The measures propose concrete support policies, including increasing the R&D expense deduction ratio for AI healthcare enterprises to 100%, establishing a 1 billion special industrial fund, and building 3 national-level AI healthcare innovation platforms. These policies have positioned Beijing as a policy highland for AI healthcare development, attracting a significant cluster of enterprises. According to statistics from the Beijing Municipal Bureau of Economy and Information Technology, as of January 2026, the city hosts 237 AI healthcare-related enterprises at 45% increase since early 2025, covering the entire industrial chain from computing power support and algorithm R&D to scenario applications. Driven by both policy and market forces, the growth trajectory of AI healthcare is becoming increasingly clear. Predictions from the CAICT's 2026 China Healthcare AI Solutions Market Research Report indicate that China's healthcare AI solutions market will exceed 22 billion yuan by 2026, with clinical application solutions accounting for 68% of the market, the largest segment. Notably, this growth stems not from short-term capital speculation but from tangible revenue conversion in essential scenarios, like primary care, drug R&D, and healthcare insurance oversight. In primary care alone, China's procurement of AI-enabled diagnostic equipment reached 4.7 billion yuan in 2025, a 58% increase from 2024, with county-level hospitals and community health centers accounting for over 70% of purchases. In drug R&D, global pharmaceutical companies will invest $8.9 billion in AI development by 2025, with Chinese firms' share rising from 12% in 2023 to 21% by 2025. What does this signify? It signifies that AI healthcare has formally transitioned from the proof-of-concept phase into the deep waters of commercial implementation, shifting from government subsidy-driven to market demand-driven. This transformation in growth models makes industry development more sustainable. To grasp the logic behind AI healthcare's explosive growth, one must first understand the underlying operational principles of its technology. While the general public may recognize ChatGPT's ability to converse and generate text, few comprehend the fundamental differences between medical AI and these general-purpose AI systems. How does medical AI differ from widely recognized general AI like ChatGPT? The core distinction lies in specialized scenario adaptation. General AI pursues universality, capable of handling diverse tasks, while medical AI prioritizes specialization and safety. It must precisely align with specific clinical, diagnostic, and therapeutic needs while meeting stringent requirements for interpretability, traceability, and low risk. For instance, an occasional incorrect response from ChatGPT may have minimal impact, but a misjudgment by medical AI could lead to missed or misdiagnoses, potentially endangering patient lives. This fundamental difference in application scenarios dictates that the technological pathways for medical AI and general AI are worlds apart. Achieving this level of adaptation relies on the synergistic collaboration of two major technical schools, symbolism and connectionism. Historically, these two schools have long been at odds. Symbolism emerged in the 1950s, advocating intelligence through well-defined rules and knowledge graphs. Connectivism gained prominence after the 1980s, leveraging neural networks and deep learning to uncover patterns through massive data training. In healthcare, these approaches do not replace each other but form a complementary ecosystem. Symbolic frameworks build knowledge graphs that provide interpretability for medical decisions, answering why this judgment. While deep learning, driven by connectionism, uncovers hidden complex correlations in data, addressing what constitutes an accurate judgment. This fusion of accuracy plus explainability resolves the long-standing industry dilemma of accuracy and explainability being mutually exclusive. For instance, in tumor diagnosis, deep learning models precisely identify lesions in medical images, while knowledge graphs explain why this lesion is a tumor by referencing relevant medical guidelines, literature, and case studies. This empowers clinicians to confidently and effectively utilize the technology. The core vehicle of symbolism is the knowledge graph, functioning like a digital medical encyclopedia but with greater intelligence and structure. Its essence lies in transforming fragmented, unstructured medical knowledge into a machine-recognizable, interconnected network. Through nodes and edges, it constructs a comprehensive medical knowledge system. Take hypertension diagnosis and treatment as an example. A mature knowledge graph integrates 18 common symptoms, 6,580 related medications, 47 diagnostic tests, and over 60,000 supporting medical literature articles. By linking this knowledge, the graph forms a comprehensive clinical decision-making framework, imparting patient symptoms, automatically matches potential disease types, recommends necessary tests, and provides appropriate medication suggestions while annotating the knowledge basis for each decision node. This white box model offers unparalleled transparency, ensuring every judgment is traceable and verifiable. When the system provides treatment recommendations, it simultaneously labels the referenced clinical guideline version. For example, Chinese Hypertension Prevention and Treatment Guidelines 2025 edition. The titles and publishing journals of cited medical literature, and treatment outcomes from similar cases. Physicians can clearly trace the source of each judgment and even click links to view full literature content and case details. The tuberculosis diagnosis and treatment project led by Beijing Chest Hospital fully validated this model's value, collaborating with 12 specialized tuberculosis hospitals nationwide. The project built the world's largest tuberculosis knowledge graph, covering 32 tuberculosis subtypes, 127 related symptoms, 89 examination items, and 43 treatment protocols. The AI-assisted diagnostic system based on this knowledge graph demonstrated significant improvements in 12,000 clinical test cases. Suspected case screening efficiency increased by over 30%. Radiologist-led image screening time reduced from 15 to 3 minutes, and misdiagnosis rates decreased by 15 percentage points. Notably, accuracy in identifying early-stage microlesions rose from 68% to 83%. This achievement has been validated by the National Artificial Intelligence Application Pilot Base and will soon be rolled out across all tuberculosis prevention and control institutions in Beijing. It is projected to help reduce undiagnosed pulmonary tuberculosis cases by over 2,000 annually. If knowledge graphs serve as the rulebook for medical AI, deep learning functions as its experience accumulator. Unlike the transparency of white box models, deep learning is termed a black box. Its decision-making process cannot be explained by simple rules. Instead, it mimics the neural network structure of the human brain, training on massive datasets to autonomously uncover hidden patterns within the data. The core advantage of this technical approach lies in its data-driven, autonomous learning without human preset judgment rules. For instance, when identifying pulmonary nodules, human experts must first summarize features like shape, density, and edges, then translate these into diagnostic rules. Deep learning models, however, require only large volumes of annotated long CT image data to autonomously learn nodule characteristics. They can even uncover subtle features overlooked by human experts, such as internal texture variations within nodules or their relationship patterns with surrounding blood vessels. This autonomous learning capability enables deep learning to demonstrate advantages far surpassing traditional methods when processing complex, variable medical data. Take AI-assisted medical imaging diagnosis as an example. The capabilities of deep learning models are astonishing. After learning from over 10 million annotated CT images, these models not only autonomously identify correlations between underlying features like pixels and textures with diseases, but also uncover imaging patterns previously unrecognized by human experts. For instance, they discovered that specific calcification patterns in certain lung nodules strongly correlate with the malignancy of lung cancer. Pattern never previously documented in medical literature. The retinal disease screening program at Ganjiakou Community Health Service Center fully demonstrates the power of deep learning. The center introduced an AI system developed by Eagle Eye Technology, specifically designed for screening diabetic retinopathy. As a common complication of diabetes, diabetic retinopathy often presents with subtle early symptoms, and irreversible vision loss frequently occurs by the time it is detected, making early screening crucial. However, primary healthcare facilities typically lack specialized ophthalmologists, hindering routine screening. Eagle Eye's AI system, trained on over 2 million retinal images through deep learning, can automatically identify pathological features such as microaneurysms, hemorrhages, and exudates, enabling graded diagnosis of diabetic retinopathy. This system has been deployed across 48 community healthcare facilities in Haidian District, screening over 120,000 patients to date. Clinical data shows its screening accuracy for diabetic retinopathy exceeds 95%, with a 98.7% accuracy rate for identifying severe lesions approaching the level of ophthalmology specialists at top-tier hospitals. More importantly, the screening process takes only 5 minutes, allowing patients to complete the examination at their local community center without needing to travel to large hospitals for appointments. This significantly enhances screening convenience and coverage. Notably, the deep learning model possesses self-evolving capabilities. Its performance improves with increased data volume, enabling seamless adaptation to evolving disease patterns and diagnostic demands. The medical field experiences rapid knowledge updates, with numerous new diseases discovered and updated clinical guidelines released annually. Traditional rule-based systems require constant manual rule updates, resulting in high costs and low efficiency. In contrast, deep learning models only need continuous input of new labeled data for fine-tuning to rapidly acquire new knowledge and patterns. For instance, when confronting novel infectious diseases, the emergence of new clinical symptoms and imaging features only requires collecting relevant case data to train the model. Within a short time frame, the model can acquire the capability to identify these emerging infectious diseases. In 2025, a novel pneumonia emerged in the Xieting region. Its clinical symptoms resembled those of common pneumonia, but its imaging features exhibited subtle differences. A research team collected imaging data from 1,000 patients with the novel pneumonia and fine-tuned an existing AI imaging diagnosis model. Within just 7 days, the model optimization was completed, achieving a 92% accuracy rate in identifying the novel pneumonia. This provided robust support for early screening and epidemic control. This self-evolving capability enables deep learning models to continuously adapt to changes in the medical field, maintaining leading diagnostic standards. However, the black box nature of AI, its lack of interpretability, remains a core concern in healthcare and a key bottleneck limiting its large-scale clinical adoption. The healthcare industry demands the highest standards of safety, where every clinical decision by a physician carries legal responsibility. Therefore, the basis for such decisions must be transparent. Consider critical scenarios like surgical planning or critical care. If an AI merely concludes recommend surgical resection of a specific area or recommend use of a certain class of drugs without explaining why, would a doctor dare to adopt such advice? The answer is clearly no. One company's AI-powered critical care monitoring system demonstrates necessary high accuracy in predicting patient deterioration during clinical trials. Yet, despite 90% predictive accuracy, no hospital dare deploy it in actual care due to its inability to explain its reasoning. Furthermore, lack of interpretability fuels algorithmic bias. If training data is skewed, models may misjudge specific demographics. With opaque decision-making processes, such biases become nearly impossible to detect or correct. These challenges have left deep learning applications in healthcare stuck in a praised but not adopted predicament. To overcome this, the industry has gradually adopted a hybrid white box plus black box architecture, seamlessly combining the explainability of knowledge graphs with the precision of deep learning. This hybrid workflow operates as follows. First, a deep learning model performs preliminary analysis on medical data, extracting complex features to generate initial diagnostic suggestions or risk predictions. Next, the knowledge graph system validates and explains these preliminary suggestions by matching relevant rules, guidelines, and literature from the medical knowledge system. providing traceable evidence for the initial recommendations. Finally, the preliminary suggestions plus explanatory evidence are presented to the physician, who then makes the final diagnosis and treatment decision based on their own experience. A secondary hypertension diagnosis project at a tertiary hospital fully demonstrates the value of this model. Secondary hypertension, high blood pressure caused by other diseases, involves complex etiologies and challenging diagnoses. Traditional methods require extensive testing, consuming significant time and effort while yielding high misdiagnosis rates. The hospital's collaborative model with a technology firm employs deep learning to analyze multidimensional patient data, including blood biochemistry indicators, genetic markers, and lifestyle habits to rapidly identify potential causes. Concurrently, the knowledge graph system references relevant clauses from the Chinese hypertension prevention and treatment guidelines, supplementing them with diagnostic outcomes from similar cases and supporting medical literature. For instance, elevated patient aldosterone, renin ratio combined with imaging features of a left adrenal nodule fuel determining model training quality and diagnostic accuracy. These three elements are interdependent and mutually reinforcing, collectively driving the continuous advancement of AI healthcare technology. In the early stages of AI healthcare development, the industry progressed slowly due to insufficient computing power, immature algorithms, and scarce data. However, with the improvement of computing infrastructure, iterative algorithm upgrades, and the accumulation of data resources, AI healthcare has now entered a phase of explosive growth. Computing power serves as the engine for AI operations, with its performance directly influencing the efficiency of model training and inference. Medical AI demands significantly higher computational resources than general AI applications due to the sheer scale and complexity of medical data. A single high-resolution lung CT scan contains millions of pixels, while a complete electronic health record encompasses diverse types of data including text, images, and laboratory results. Training a mature medical AI model often requires processing billions of data points. Current computational demands in medical AI exhibit polarized characteristics. Auxiliary diagnostic systems at primary healthcare facilities, such as initial screening imaging equipment in community health centers, require relatively low computational power, easily met by standard servers or edge computing devices. Conversely, high-end applications like AI-driven drug discovery, protein structure prediction, and multimodal medical large model training demand extreme computational resources, necessitating GPU clusters of thousands or even tens of thousands of cards for robust support. For instance, training a large-scale image diagnosis model covering multiple tumor types requires processing over 100 million images. Using standard servers would take years, whereas a 1,000-card GPU cluster completes the task in just 3 to 6 months. In AI-driven drug discovery, simulating the binding process between drug molecules and targets, which traditionally takes months, can now be accomplished in mere days with a 10,000-card GPU cluster. This disparity in computational demands has spurred diversification in supply. Computing zones that offer pay-as-you-go computing services to SMEs. Enterprises no longer need to purchase expensive computing equipment themselves. They can simply lease computing resources from cloud platforms based on their needs, significantly reducing computing costs. For example, a startup AI healthcare company training a small-scale diabetes diagnosis model can lease Tencent Cloud's computing services at a cost of only 1/5 of purchasing its own equipment. In 2025, the National Artificial Intelligence Application Pilot Base was established in Beijing, with one of its core functions being the construction of a public computing power support platform. This platform integrates teraflop-level GPU cluster resources, offering free or low-cost computing services to domestic medical AI enterprises, with a focus on supporting foundational research and startups. This initiative will undoubtedly lower the technological R&D barriers for SMEs and unleash the industry's innovative potential. At the algorithmic level, a transition from single models to multimodal hybrid architectures is accelerating, driven primarily by the diversity of medical data. Medical data exhibits extreme complexity, encompassing text-based data, image-based data, structured data, time series data, and more. The different data types possess distinct characteristics, requiring specialized algorithmic frameworks for analysis. Text data demands natural language processing algorithms. Image data requires computer vision algorithms, and time series data necessitates time series analysis algorithms. Single models can only process one type of data, failing to meet the multidimensional data analysis demands of clinical diagnosis. For instance, diagnosing a complex cardiovascular disease requires integrating a patient's textual medical records, imaging data, laboratory test results, and time series data for a comprehensive assessment. Neither a standalone text model nor an image model alone can accomplish this task. How could a single model achieve full scenario adaptability? The answer is impossible. Consequently, multimodal hybrid architectures capable of integrating diverse algorithmic frameworks and processing multiple data types have become an inevitable trend in algorithmic development. The success of AlphaFold fully validates the trend and value of multimodal fusion. Developed by DeepMind, AlphaFold is a protein structure prediction model that integrates multiple algorithmic architectures including deep learning, reinforcement learning, and graph neural networks to simultaneously process gene sequence data, amino acid sequence data, and protein structure template data. This approach elevates protein structure prediction accuracy to unprecedented levels. Prior to AlphaFold, protein structure prediction was a major challenge in biology. Scientists relied on experimental methods like X-ray crystallography and NMR spectroscopy to determine protein structures, a process taking years and incurring high costs. AlphaFold, however, requires only the protein's genetic sequence to predict its three-dimensional structure within hours, achieving 98% accuracy, virtually matching experimental results. This breakthrough has laid a solid technical foundation for AI-driven drug discovery. The core of drug development lies in identifying drug molecules that bind to disease-related protein targets. Accurate protein structure prediction empowers scientists to design drug molecules with greater precision, significantly boosting drug development efficiency. Currently, leading companies are developing multimodal medical large models, forming a dual-track approach of general medical large models and vertical domain large models. OpenAI and Google DeepMind focus on general medical large models, aiming to build all-purpose models capable of handling diverse medical tasks. Domestically, Huawei Pangu and Health and Jipu Health are deepening their expertise in vertical domains, launching multimodal large models for medical imaging diagnosis, chronic disease management, and cancer treatment, respectively. Taking Huawei Pangu's medical model as an example, it integrates multiple algorithms including computer vision, natural language processing, and time series analysis, capable of simultaneously processing images, medical records, and laboratory data. It achieves a 96% diagnostic accuracy in lung cancer scenarios by comprehensively analyzing patients' CT scans, electronic health records, and laboratory metrics, and 8 percentage point improvement over single-image models. Notably, these underlying large models are not directly intended for clinical applications. They function more as foundational engine capabilities that require encapsulation and adaptation to transform into services directly usable by clinicians. The core aspects of this adaptation process include three key elements. First, developing user interfaces tailored to clinical scenarios, enabling physicians to conveniently input data and view results. For instance, integrating large model capabilities into hospital PACs or EMR systems allows doctors to access AI functions directly within their existing workflows. Second, implementing security protocols including data encryption, access controls, and operation logging to safeguard medical data privacy and compliance with regulations like the cybersecurity law and medical data security guidelines. Third, integrating knowledge retrieval and medical record databases to enrich the output of large models. Microsoft's Jackson Copilot exemplifies these foundational capabilities plus scenario encapsulation model. Built upon OpenAI's general-purpose large model, it has been specifically adapted for medical record writing and prescription issuance scenarios, integrating seamlessly into hospital EMR systems. After patient consultation, clinicians need only input basic symptoms and test results. Jackson Copilot then automatically generates standardized electronic medical records while recommending appropriate medical orders based on the patient's condition. Physicians can complete documentation and order entry with minimal editing and confirmation, achieving over 40% efficiency gains. Ant Group's Alpha system in China follows a similar model, built upon Ant Group's underlying large language model and tailored for chronic disease management scenarios. It integrates into community health service centers' management systems. This enables personalized health monitoring and management recommendations for patients with hypertension and diabetes. Among the three key elements, data is the core determinant of AI healthcare's value and the industry's greatest bottleneck. The adage garbage in, garbage out underscores the critical importance of high-quality medical data. If training data is subpar, biased, or incomplete, even the most powerful computing resources and advanced algorithms will produce models that fail to meet clinical needs, potentially yielding erroneous diagnoses. The quality of medical data manifests in 3 dimensions. First, accuracy data must truthfully reflect patient conditions and treatment processes without errors or false information. Second, completeness data must encompass the entire patient journey, including basic information, symptoms, test results, diagnostic conclusions, and treatment plans with no critical omissions. Third, annotation quality. For supervised learning models, data requires professional annotation such as radiologists labeling lesion locations and types in imaging data, or physicians annotating disease diagnoses in medical records. Annotation accuracy directly impacts model training effectiveness. However, acquiring high-quality medical data remains exceptionally challenging in practice, constituting a core bottleneck constraining AI healthcare development. Unlike general AI, which can access publicly available data across the internet, core medical data, annotated electronic medical records, high-resolution imaging, drug molecular structures, gene sequences, etc. is primarily held by hospitals, pharmaceutical companies, and research institutions. This highly sensitive, privacy-protected asset cannot freely circulate. According to regulations such as the Personal Information Protection Law of the People's Republic of China and the regulations on the management of medical records in medical institutions, medical data involves patients' personal privacy and health rights. No entity or individual may collect, use, or disseminate such data without authorization. While this regulation safeguards patient privacy, it also results in the closed nature of medical data. The medical knowledge of general large models mostly originates from publicly available medical literature, textbooks, and teaching cases. These data sources are limited in quantity and lack specificity, making it difficult to meet the demands of precise clinical diagnosis and treatment. For example, the lung CT images learned by general large models are mostly typical teaching cases, whereas clinical practice encounters more atypical cases. General large models cannot access data from these atypical cases. Thus, their accuracy in clinical diagnosis is significantly compromised. Furthermore, inconsistent data formats across medical institutions pose a major challenge. And PACS systems used by different hospitals come from various vendors, resulting in disparate data formats. Even data of the same type cannot be directly integrated, requiring extensive data cleaning and standardization. This further increases the cost of data acquisition and utilization. A research and development lead at an AI healthcare company once candidly stated, "Half of our team's effort is spent addressing data issues including collection, cleaning, annotation, and standardization, leaving only half for actual model development." How to overcome this challenge? The hospital enterprise collaborative development model has emerged as the industry standard. By leveraging complementary resources, this approach enables compliant medical data usage and precise model development. Within this model, hospitals and enterprises each fulfill distinct roles. Hospitals serve as both data providers and demand drivers, supplying authentic clinical data and specifying application requirements. They also participate in model testing and validation to ensure clinical relevance. Technology companies, as the technical providers, contribute algorithms, computing power, and engineering expertise. They are responsible for model development, optimization, and system integration while ensuring data security and compliance. To guarantee data compliance, both parties typically sign strict cooperation agreements that clearly define the scope, duration, and responsibility allocation for data usage. They also employ techniques such as data de-identification and anonymization to remove sensitive information like patient names, D numbers, and contact details, ensuring the data cannot be linked to specific individuals. As of January 2026, the Collaborative Hospital Network for the Senior TCM Practitioner-Assisted Diagnosis Model Matrix project alone has expanded to 246 hospitals, covering 17 provinces, 4 autonomous regions, and 1 municipality across China, forming a large-scale clinical data collaboration network. Led by a renowned Chinese medicine university in China and jointly developed with multiple technology companies, the project has collected clinical case data from over 500,000 renowned senior TCM practitioners. After undergoing de-identification and standardization, this data is used to train large-scale TCM auxiliary diagnosis and treatment models. The model simulates the diagnostic reasoning of renowned TCM practitioners, providing primary care physicians with recommendations for TCM syndrome differentiation and formula prescriptions. It has been deployed in grassroots medical institutions, serving over 800,000 patients cumulatively and effectively enhancing the quality of TCM diagnosis and treatment at the community level. Beyond the TCM, the hospital enterprise collaborative development model has been widely applied across multiple fields including oncology, cardiovascular medicine, and neurology, driving the implementation of a range of high-quality AI medical products. The compliant path for data sharing is being paved by federated learning technology, while hospital enterprise joint development addresses data collaboration between individual enterprises and hospitals. Federated learning resolves data sharing challenges across multiple institutions. The core logic of this technology is straightforward. Data remains stationary while models travel to learn. Traditional model training requires consolidating data from multiple institutions, posing risks of data privacy breaches. In contrast, federated learning eliminates the need to move raw data. Each institution trains models locally using its own data, then uploads the model parameters to a central server. This server aggregates and optimizes the parameters to form a global model. The global model is then distributed back to each institution, which fine-tunes it using its own data. This iterative process continues until model performance reaches its peak. Specifically, after completing local model training, each medical institution only needs to upload encrypted parameter weights to the central server for aggregation, thereby forming a globally optimized model. Throughout this process, raw data remains stored on each institution's local servers, never leaving the hospital's internal network, fundamentally eliminating the risk of data privacy breaches. Simultaneously, parameters undergo encryption during upload and aggregation, ensuring parameter information cannot be stolen. This model achieves collaborative utilization of multi-institution data while safeguarding patient privacy, perfectly balancing data utilization and privacy protection needs. The advantages of federated learning are particularly prominent in rare disease. Diagnosis: rare diseases have extremely low incidence rates, and a single hospital's case volume is insufficient to support model training. Through federated learning, however, integrating rare disease case data from multiple hospitals nationwide enables the training of highly accurate rare disease diagnostic models. A rare disease diagnostic alliance partnered with a technology company to integrate 15,000 rare disease cases from 32 hospitals nationwide using federated learning. The resulting diagnostic model covers 217 rare diseases with 89% accuracy, 35 percentage point improvement over single hospital diagnostics. This model has been deployed across alliance hospitals, enabling early diagnosis for numerous rare disease patients and preventing misdiagnosis and inappropriate treatment. Beyond clinical diagnostics, federated learning has also been applied in drug development and public health surveillance, establishing itself as a core technical pathway for medical data sharing. Beijing's latest AI healthcare policy explicitly designates federated learning as the core technical approach for data circulation, supporting medical institutions in building cross-regional specialized disease datasets through this method. To advance federated learning adoption, Beijing has established a medical data federated learning platform offering free technical support and computing services to institutions and enterprises. The Beijing Chest Hospital, affiliated with Capital Medical University, spearheaded the development of a standardized tuberculosis CT image dataset using federated learning. This project integrated 200,000 tuberculosis CT images from 16 specialized hospitals across Beijing, Shanghai, Guangdong, Sichuan, and other regions. Supported by the federated learning platform, hospitals locally annotated and pre-processed imaging data before uploading model parameters to the platform for aggregation, ultimately forming a standardized tuberculosis CT image dataset. This dataset not only provides high-quality data support for developing AI-based tuberculosis diagnosis models but also establishes industry standards for tuberculosis CT image annotation, filling a gap in China's relevant field. According to the project lead, this dataset has been made available to over 20 domestic AI healthcare companies, supporting their development of tuberculosis diagnostic models. It is expected to accelerate the launch of high-quality AI-based tuberculosis diagnostic products, thereby enhancing China's overall tuberculosis prevention and control capabilities. Continuous policy enhancements are clearing obstacles for data circulation. The implementation of National Data Element Action Plans has clarified the value of medical data as a production factor, encouraging data transactions under compliant conditions. This plan proposes a series of measures, including establishing a classification and grading management system for medical data, clarifying the circulation scope and methods for different levels of medical data, supporting the construction of medical data trading platforms to promote the compliant circulation and market-based allocation of high-quality medical data, and improving mechanisms for data rights confirmation, pricing, and trading to safeguard the legitimate rights and interests of data providers, users, and patients. These measures provide top-level design for the compliant circulation of medical data. Prior to this, the 2024 State Council document Opinions on Developing the Data Element Market also designated medical data as a key data element, proposing to explore mechanisms for sharing and trading medical data to promote its rational utilization. These policies have transformed the previous situation, where medical data was unable or unwilling to circulate, enabling its value conversion under compliance frameworks. Local-level initiatives have been even more proactive, with multiple provinces and municipalities advancing the construction of medical data trading platforms and the market-oriented circulation of medical data. Beijing has proposed accelerating the construction of a universal health information platform to integrate various medical data and establish data anonymization and annotation standards, laying the groundwork for medical data transactions. Shanghai, meanwhile, has pioneered the nation's first provincial-level medical data trading platform, the Medical Data Zone of the Shanghai Data Exchange, officially launched in 2025. This zone initially listed over 20 specialized disease data packages covering multiple fields including oncology, cardiovascular diseases, and diabetes. As one of the first data providers, Shanghai First People's Hospital has completed the organization of over 20 specialized disease data packages, which have been listed on the exchange. These packages include annotated electronic medical records, imaging data, and laboratory test results. After undergoing de-identification, they are available for purchase by AI healthcare companies and research institutions. According to Shanghai Data Exchange statistics, by January 2026, the Medical Data Zone had achieved a transaction volume of 120 million yuan. A total of 87 enterprises and research institutions purchased medical data through the platform for AI model development and medical research. Beyond the Shanghai, provinces including Guangdong, Zhejiang, and Jiangsu are advancing the development of medical data trading platforms, forming a medical data circulation framework characterized by national guidance and local implementation. These initiatives not only provide high-quality data resources for AI healthcare enterprises but also explore viable pathways for transforming the value of medical data. A representative from the Beijing Health Big Data and Policy Research Center stated that efforts are currently underway to establish a comprehensive regulatory system covering data standards, security compliance, privacy protection, and ethical review, leveraging the National AI Application Pilot Base. This framework comprises three core components. First, a data standard system that establishes unified formats, coding, and annotation standards for medical data to resolve inconsistencies across institutions. Second, a security and compliance system that implements a tiered classification management mechanism for medical data, clarifying security requirements for data collection, storage, usage, and transmission to ensure legal compliance. Third, an ethics review system that establishes a medical data ethics review committee to conduct ethical assessments of data usage, safeguarding patients' legitimate rights and interests. Concurrently, relevant authorities are exploring incentive mechanisms for data submission and utilization. These include financial subsidies and preferential treatment in research projects for hospitals, providing high-quality medical data, alongside tax incentives for enterprises purchasing medical data for R&D. Such measures aim to ensure a steady flow of quality data to the R&D sector. Once implemented, these initiatives will gradually dismantle long-standing data silos, providing core support for the scaled development of AI-driven healthcare. Industry experts predict that as data circulation mechanisms continue to improve, the cost of acquiring medical data will decrease by more than 50% within the next 3 to 5 years. This will further drive innovation in AI healthcare technologies and the widespread adoption of related products. Driven by both policy and technological advancements, AI healthcare has permeated the entire healthcare process from disease prevention, diagnosis, and treatment to rehabilitation management. From personal health management to public health emergencies covering nearly every aspect of healthcare. The guidance on AI model medical application scenarios released by the National Health Commission in late 2025 systematically categorizes these applications into 4 major domains, 13 modules, and 84 specific scenarios. The 4 domains are clinical diagnosis and treatment, public health, health management, and pharmaceutical R&D. The 13 modules include medical imaging-assisted diagnosis, clinical decision support, surgical assistance, infectious disease monitoring, chronic disease management, and drug development. The 84 specific scenarios encompass multiple specialized directions such as CT imaging diagnosis for lung cancer, chronic hypertension management, tumor surgery planning, and early warning for emerging infectious diseases. The release of these guidance clearly outlines the blueprint for industry development, providing explicit directional guidance for corporate R&D and hospital applications. According to statistics from the National Health Commission, by the end of 2025, over 5,000 medical institutions nationwide had implemented AI healthcare products, covering more than 60% of the specific scenarios outlined in the guidelines. The application scope of AI healthcare continues to expand. From primary care to drug development, from healthcare insurance oversight to public health emergencies, AI technology is reshaping every aspect of medical services. Which scenarios show the most promising commercial progress? The answer lies in the areas with the most urgent needs and the most prominent value. Analysis of industry data and corporate practices reveals that current AI healthcare commercialization is primarily concentrated in 4 core scenarios: primary care assistance, AI-driven drug discovery, intelligent medical insurance oversight, and chronic disease management. These 4 scenarios have achieved commercial breakthroughs first because they all share the characteristics of strong demand rigidity, high willingness to pay, and significant potential for scaling. Primary care assistance addresses the pain points of staff shortages and technological gaps in grassroots medical institutions. AI-driven drug discovery solves the challenges of lengthy R&D cycles, high costs, and low success rates for pharmaceutical companies. Intelligent healthcare insurance oversight tackles the difficulties of complex supervision and severe fund wastage for insurance authorities. Chronic disease management resolves the issues of inconvenient management and high complication risks for patients, as well as large patient volumes and heavy clinical burdens for hospitals. Commercial progress in these 4 scenarios not only drives growth in the AI healthcare industry but also provides replicable experience for other applications. Primary care settings undoubtedly represent the core breakthrough point for AI healthcare implementation. China has long grappled with uneven distribution of medical resources, with high-quality care concentrated in tertiary hospitals in major cities, primary care institutions, county hospitals, community health centers. Township clinics universally face talent shortages and weak technical capabilities. According to the 2024 Statistical Bulletin on China's Health and Healthcare Development, released by the National Health Commission, primary care facilities account for only 45% of the nation's healthcare professionals but handle over 60% of the total medical services. The shortage of specialized physicians including radiologists, sonographers, and ophthalmologists in primary care settings exceeds 200,000. As tiered diagnosis and treatment policies advance, the service pressure on primary healthcare institutions continues to grow, making the shortage of radiologists and specialists increasingly acute. Many primary institutions cannot perform routine imaging screenings or chronic disease management, forcing patients to seek care at tertiary hospitals in major cities. This further exacerbates the challenges of difficult and expensive access to healthcare. The integration of AI technology offers an effective solution to this problem. Through AI-assisted diagnostic systems, primary care physicians can leverage technological capabilities to enhance their diagnostic and treatment capabilities, compensating for shortages in personnel and technology. A representative from the Ganjiakou Community Health Service Center admitted that while many community health centers have established radiology departments, they struggle to recruit professional radiologists. Previously, the center relied on remote consultations with physicians from higher-level hospitals within its medical consortium for lung CT screening. Due to the heavy workload of these specialists, response times were lengthy, averaging 2 to 3 days for consultation results, leading some patients to abandon examinations due to excessive waiting periods. Additionally, the spot check model of remote consultations prevented the comprehensive screening of all images, creating risks of misdiagnosis. The introduction of AI technology has fundamentally transformed this situation. The center's AI-powered imaging quality control system enables comprehensive screening for common conditions such as pulmonary nodules, retinal lesions, and osteoporosis, generating results instantly without delays. For suspected high-risk cases, the system automatically flags and prioritizes referrals to senior hospital physicians for review, reducing response times to under 30 minutes. Notably, The AI-assisted assessment technology for retinal lesions has been deployed across 48 community healthcare facilities in Haidian district, establishing a closed-loop chronic disease management system featuring community screening, tertiary confirmation, and bidirectional referrals. Beyond imaging screening, the center has implemented an AI-powered chronic disease management system. This system collects patient health data through smart devices like blood pressure monitors and glucose meters, providing personalized health recommendations and medication reminders based on data trends while assisting physicians in developing follow-up plans. The center's director noted that since implementing AI systems, diagnostic efficiency has increased by 35%. Misdiagnosis rates have decreased by 28%, and patient satisfaction has risen from 82% to 95%. More patients now choose community-based care, effectively realizing the goal of minor illnesses treated locally. Data speaks volumes. In the first half of 2026, nationwide procurement of AI-enabled diagnostic equipment by primary healthcare institutions is projected to surge by over 60% year-on-year. County-level hospitals will lead this growth, accounting for 52% of purchases. By category, imaging-assisted diagnostic devices dominate at 45%, followed by chronic disease management systems at 28%. AI-assisted diagnosis accuracy in common and prevalent diseases has surpassed 95%, approaching the level of attending physicians at county-level hospitals. In certain specialized areas, it even matches the expertise of specialists at top-tier tertiary hospitals. For instance, AI achieves over 95% accuracy in scenarios like diabetic retinopathy screening, tuberculosis imaging diagnosis, and early lung cancer screening. Behind these figures lies a substantial enhancement in primary healthcare capabilities. And more importantly, AI-driven drug discovery has emerged as another major growth driver for the industry. How challenging is traditional drug development? It involves long cycles, high costs, and low success rates, with an average R&D timeline of 4.5 years and expenditures exceeding $1 billion. The integration of AI technology is significantly accelerating this process. In silico medicine stands as a leading enterprise in AI-driven pharmaceuticals. Between 2021 and 2024, it has nominated 20 preclinical candidate compounds PCCs, achieving an average time from project initiation to PCC nomination of just 12 to 18 months. Each project requires synthesizing and testing only 60 to 200 molecules, representing a several-fold increase in R&D efficiency compared to traditional methods. Such efficiency gains are nothing short of revolutionary in drug development. On January 5, 2026, in silico medicine entered into a multi-year R&D collaboration with Sanofi, France's second-largest pharmaceutical company, focused on developing novel drugs targeting challenging oncology targets. The partnership is valued at up to $888 million. This marks the first BD transaction in the biopharmaceutical industry in 2026. Under the agreement, in silico medicine will receive an upfront payment of up to $32 million and milestone payments tied to R&D milestones, while Sanofi will lead subsequent clinical validation and commercialization efforts. Prior to this, in silico medicine had already established collaborations with companies including Fosun Pharma, Sanofi, and Eli Lilly. In 2024, its $85.834 million revenue included $52 million in technology licensing income solely from its largest client, Exelixis. This figure fully validates the feasibility of the AI-driven drug discovery licensing model. However, the commercialization journey for AI-driven drug discovery remains fraught with challenges. As of early 2026, no new drug entirely developed by AI has successfully reached the market globally. Several AI-driven drug pipelines that reached clinical trials were discontinued due to subpar trial data. In silico medicine's current development status mirrors the industry's broader predicament. Although it successfully listed on the Hong Kong Stock Exchange, raising $2.277 billion Hong Kong dollars to become the highest funded IPO in Hong Kong's biopharmaceutical sector in 2025, the company remains unprofitable. Financial data shows losses of $222 million, $212 million, $17.096 million, and $19.215 million for 2022 to 2024 and the first half of 2025, respectively. While the loss margin is gradually narrowing, the company remains distant from break-even. Ren Fang, co-CEO of In Silico Medicine, stated that the biopharmaceutical sector falls under the realm of patient capital, where high-intensity, early-stage investment aligns with industry norms. Moving forward, The company will accelerate progress toward profitability by increasing early-stage project licensing partnerships, establishing a virtuous cycle of R&D investment plus collaborative monetization. Capital markets exhibit divergent views on AI-driven pharmaceuticals. Optimists emphasize the sector's long-term potential, confident that technological breakthroughs will yield substantial returns. Pessimists, however, express concerns about implementation uncertainties and remain hesitant to invest. This divergence precisely reflects that AI-driven pharmaceuticals remain in the early stages of commercialization. Traffic tags. Driven by policy support and technological breakthroughs, AI healthcare has officially entered the deep waters of commercialization. From AI image screening in primary care clinics to R&D collaborations with multinational pharmaceutical companies, this transformation has permeated the entire medical process. This video explores the core advantages of the white box plus black box hybrid architecture, dissecting the synergistic logic of three critical elements: computing power, algorithms, and data. It focuses on two key breakthroughs: primary care diagnostics and AI-driven pharmaceuticals, unlocking the commercial logic and industry opportunities behind this trillion-dollar market. The important note is, this video provides analysis of the AI healthcare industry and does not constitute medical diagnosis or treatment advice. Consult a licensed physician for specific medical care. Enjoy this in-depth tech and industry content. Subscribe to the channel, give it a thumbs up, and turn on notifications to stay updated on cutting-edge industry insights. Have questions or want to discuss? Feel free to engage in the comments section. From concept to reality, AI healthcare policy and technology double support. A trillion-dollar market opportunity is here. Act now.